Good afternoon, everyone. I'm Paul Roberts. I'm the CEO of GPDQ, and I'm here to talk to you about primary care. So GPDQ exists to make it as easy as possible to see a doctor. So the mission for us is all about building a sustainable healthcare system. The part that makes it not sustainable is too much is happening in secondary care. It's expensive. So the key for us is community-based primary care, and our role is making that community-based primary care as accessible and affordable as possible. So the core of what we have is a doctor visiting service, and we were the UK's first accessible via an app. But what really differentiates us now is that we have a full multi-channel offer, and I'll come on to describe a bit more about what that means, following on from Shafi's introduction. And also that we are set up very much as a B2B service provider. And we have a series of relationships already with employers and insurers that are demonstrating the traction that we have with that angle. So just thinking about the problem in the UK, the size of the opportunity and what we're solving for the different constituency groups. So we started out and proved our concept in the direct-to-consumer market. The patient problem there is that, especially in the UK, there are quite long lead times to get in to see your doctor. The access mechanic is quite complicated and convoluted. And then even when you are in, you've fundamentally got to take half a day out of your working day if you're in the workforce to go and do that. And it's only really running Monday to Friday. So we said, look, let's turn that on its head. Let's make the lead time, certainly same day, if not within a couple of hours rather than a couple of weeks. Running the service 8 a.m. to 11 p.m., 7 days a week. And crucially, raising the bar on the quality of that service as well. So in the UK, your kind of standard doctor consultation length is just 9 minutes. And we're offering a much longer period of time, sort of 30 minutes as standard, to really get to the bottom of what's going on and to leave people on their way with the information and the reassurance that they need. But fundamentally, if we're going to have an impact at a system-wide scale, we need to be free at the point of need, and we need to be working with groups who already hold a lot of the patient relationships. So for us, that's then involving two different angles. One is working with employers and insurers, and the other with publicly funded groups, which is the NHS in the UK. And so the problem that we're solving there for employers is one of absence, which is the cost of having employees off sick, presenteeism, which is when they're turning up to work, but they're not terribly effective. And that cost in the UK alone is approaching £100 billion a year. And they're spending a sizable sum of money directly with healthcare providers to solve that. But a lot of the solutions out in the market are fragmented. They're solving individual components of the puzzle. So what we've developed, and I'll come on to talk about that in a bit more depth, is a complete solution that comes into the workplace to really remove all of those barriers to access for employees. For insurers, they're subject to a lot of the cost pressures that we've been seeing in secondary care, and the opportunity that we have working with them is to effectively head off problems in primary care through preventative services and through early diagnosis of conditions that would be a lot more expensive to treat later. In terms of the publicly funded service, to really quantify this cost of not getting access to primary care right, in the UK there's a £3.3 billion a year cost attached to avoidable emergency admissions. So this is people arriving in hospital, staying in hospital when they could have been dealt with in primary care. And we've got a big opportunity there to work, particularly looking after the elderly and most vulnerable who are least well served by the current system. So what do we mean by multi-channel? It's one of those lovely terms that gets bandied about. Really, in primary care, there's three main ways in which you can see a doctor. There's face-to-face, doctor coming to you. There's face-to-face, you going to the doctor in clinic. And there's video services via telemedicine. And we're unique in having assembled a way of accessing that through all three of these modes. So we offer patients, in the same way that if you're a retail consumer, you expect now to consume services across a range of different channels at a time in a way that suits you. Patients are no different. So we offer patients the opportunity to do just that with a service that actually joins up and integrates across all of those different channels. So for us, if it's all about developing those complete end-to-end solutions, we can do all of that ourselves, but we also partner with a number of the different specialists in the ecosystem, some of these other channel specialists, to create complete solutions. So we will then cover off the elements of the channel that they're not delivering. So for example, we work with telemedicine providers to deliver the face-to-face care that is quite often needed in association with that service. Being multi-channel, though, it's not just about technology and putting that in its place, if you like. It's also about the capabilities. So the core of what we do is GP, is providing doctors. And doctors sit at the center of a universe of coordinating care, but it has to be wider than that if we're really going to build what we're doing around the patient. So we've also partnered to offer physio, mental health, audiology, and a wider range of services. That means that we can really join up the experience for patients and really determine efficiently and effectively what it is that they need to do to stay healthy and to get better. So I said I'd elaborate a little bit more on the workplace proposition. This is it's a big deal over in the US, sort of much more common there than it is in Europe. But what we've done is we've assembled a complete set of sort of proposition modules, if you like, that can be assembled case by case, running all the way through from prevention, which is your health assessments and your vaccinations, through to a core around providing a doctor service on site. And that can be reactive, but really the anchor proposition that we have is the provision of a regular clinic. So it's bringing the doctor absolutely into the workplace. The amount of time that an employee needs to spend off work then is just the 20 minutes to have the appointment. And crucially, we're then front of mind for employees as well. I think all too often healthcare provision in the workplace can feel like a worst case scenario, something that you lean on when you're really in trouble, but actually you may have forgotten it's even there. We're trying to be there regularly with the objective to touch and to interact with every single employee with the goal of moving the needle on those population health outcomes. So not about the service, but about the outcome. And as a result, delivering quite clear benefits financially for employers through a reduction in absence and presenteeism costs. In terms of how we are delivering that service and selling it, we both work directly with employers, but crucially, we also have relationships with around 30 global insurance groups, including global framework agreements with some of the largest. And the opportunity there is really to start to develop out the service into full end-to-end service provision. And we also work on a white label basis, really adopting that mindset of acting as a B2B service provider. I think very often it's tempting as a startup to make it all about you, about your brand, about acquiring customers directly. Whereas really, if we want to have the maximum impact, we need to be working far and wide in collaboration with the wider ecosystem. The doctors are a really important part of this. We now work with around 80 nationwide in the UK and some across in the Republic of Ireland as well. And the proposition for doctors is crucial. So a lot of what is driving the lack of access to primary care is the fact doctors don't want to be doctors anymore. And so we thought very hard about the proposition for doctors working in a really high-quality clinical environment, proving that you don't need to trade off innovation for clinical excellence, and thinking about the elements of community and doctors coming together, increasingly working in a portfolio basis. It can feel very atomized out there. In terms of the team, we've got a wide range of commercial and clinical experience at the exec level. And we have a fantastic advisory board, not the least of whom is none other than Shafi. But for us, it's really about how we bring highly relevant clinical expertise with the expertise of somebody like Dale, who runs data and AI at Avanade, and really thinking about the insights that we can draw from our population level data. So rather like the previous speaker, we are raising our Series A currently. So if this is resonating with you, I would love to have a conversation with you afterwards. Thank you.
Thank you very much.